I'm a labor and delivery nurse, and for the 12 days of Christmas, I am going to be sharing a tip, trick, or frequently asked question on my account. So for day number 4, let's talk about natural ways of inducing labor. If you have reached your due date and you've gotten the all clear from your doctor, then here are some things that you can try to naturally induce labor. Number 1, a membrane sweep. This is something that your healthcare provider would have to do, and this is basically where they insert their fingers into your vagina, find your cervix, and do a little stretch and sweep of the cervix, which can usually start the labor process within 24 hours, or at least get you some cramps and contractions going and stimulate your body. Number 2 is sexual intercourse. So this is actually strongly recommended for those of you who want to go into labor or are trying to induce labor. There's something about stimulating the cervix, something about the semen. All of these things have been studied, and it has been proven to work. This isn't something you're going to be wanting to do when you're 9+ months pregnant, but trust me, it can actually induce labor. Another thing is movement. So going for a walk, moving your body, going in the mall and just walking around. Lots of my patients, they come in and they're like, my water broke, or I'm in labor. And I was like, what were you doing today? And they're like, oh, I was walking around the mall, or I went to a park for a day, or I was chasing after my 2-year-old all day. These are things that always put women into labor, moving the body. Now, a lot of you have probably heard of castor oil, and I personally don't love the idea of castor oil because the way it works is by stimulating your bowels. So this is kind of the same idea as spicy foods. So this stimulates your bowels, gets your bowels going, and basically causes diarrhea. And when that happens, that your uterus is right beside your bowels. So the thought process is it will stimulate your uterus to start contracting. So if you are okay with being on the toilet for a long time, then maybe this is an option for you, but always check with your doctor before trying anything like this.